I'm Darren Gowdy, the Project Manager of Health and Mind, and I'd just like to outline the work and how our work is delivered within Libraries NI's venues, and I would like to just outline the project itself. Health and Mind aims to raise awareness and understanding of good mental health and to provide opportunities to improve well-being through information, learning and reading. We work in partnership with the 4 leading mental health charities who are Action Mental Health, Aware, Defeat Depression, Mindwise and of course Cause. Libraries NI is the lead organisation, the lead body behind the project, and we are funded by the Big Lottery Fund through the Live and Learn programme, and we have just recently received an extension from January 2015 until January 2016, so it's good to know that we'll still be here next year to continue on with our good work. The project itself is delivered by the Health and Mind team, partners and volunteers. The team work closely in a range of events with Libraries Northern Ireland staff, and we deliver our programmes to and with Health and Mind beneficiaries. In terms of where we deliver these projects and activities, the project operates in library venues across Northern Ireland, some of which, there's 96 libraries, of which 16 are actually mobile. To ensure a good spread of delivery, we agreed an outreach strategy which states that we will work with across all libraries, Northern Ireland business areas, of which there are 4 business areas. The 96 libraries are across the province in a range of communities, and we provide programme, events, activities within large and small library venues, and we try and prioritise libraries that are disadvantaged, rural and those identified for increased membership across the province. So again, if you're not a library member, it might be an idea to try and get an application form and join up, because they are a great resource, and it's not just about books, there's a lot of other things that we can offer too. We've also received funding for a rural project from Darren Decal, and after the initial successful pilot within rural libraries, that has continued to be funded again until March 2015 to provide more programmes and services in rural isolated areas. And we also aim to respond to need. If we get requests or certain demands from people, we will try and respond to that and meet those requests. And also we try and keep up to date with current local health, mental health research where it exists, and we'll try and respond to that need. In terms of locations, the map behind me, you can see that the libraries do exist nearly in every community. And sometimes I think it's good that they're viewed as the hub of those communities. And they're also seen as neutral and non-stigmatised. So when you're dealing with issues around mental health, it's good to have a non-stigmatised environment, and I think libraries can provide that. And a lot of the concentration of libraries would be around the greater Belfast area, and we would have a range of libraries both in north, south and east and west areas. And in terms of how we develop the project, there's 3 strands really in relation to the project. One being information, the other learning, and finally reading. And in relation to training, the Libraries Northern Ireland staff establish mental health and wellbeing reading areas within the libraries. They organise bibliotherapy and displays at associated health and mind events, roadshows, talks and workshops that we would provide. There's participation in mental health first aid training and awareness training programmes, which gives staff an understanding of mental health issues in terms of service users who would access a library that they might be experiencing. We can enable access to rooms for training courses delivered by partners and give participants a tour of the library, and also encourage increased membership and obviously borrowing. And also in relation to information, I do a lot of local PR work on health and mind events held in venues and roadshows. We also advertise in local press as well through radio and newspaper. A toolkit has also been developed by the Health and Mind team to act as a resource for local libraries to use as they see fit, and it also highlights key dates and provides ideas on promotional events. Libraries in Northern Ireland are also providing Wi-Fi access in many of their facilities, and that obviously encourages more younger users, which they're trying to increase the membership rate of. In relation to reading, there's bibliotherapy and Beating the Blues, which is a computerised cognitive behavioural therapy programme. And also there are existing Libraries NI initiatives that Health and Mind promote further. Libraries NI staff promote bibliotherapy collections and wider health and wellbeing resources also to borrowers. So when you go into the library, staff are well aware of what's available in terms of mental health and wellbeing resources, and also resources in relation to caring, as well as been mentioned by the previous presenters. Small numbers of Libraries NI staff are trained also in read aloud activities, but the Health and Mind team deliver the majority of that in terms of reading groups and to support partner programs and projects. In terms of some of the workshops that we would provide, the Health and Mind team would provide a range of workshops along with tendered facilitators who would come in and provide programs for us. And a lot of those programs have been innovative, and they have been used as an example of best practice, so much so that we've found that a lot of the facilitators are also getting more work from other organisations and other partners. So obviously Health and Mind have created that impetus and been used and seen as an innovative model of best practice. In terms of the workshops we provide, Read Aloud, which would be a bit like a reading group, and it would be enjoying the benefits of shared reading. And we provide those on a one-off basis and also in a group basis as a course. Knit and Natter, there are some 84 groups across the 70-odd libraries that provide that service. And what we've found with that is that increases social inclusion and also enhances personal resilience as well through having that social contact within that group of people who are participating in the Knit and Natter sessions. Bibliotherapy, self-help books can be highly effective in helping people's mood. So obviously for carers, this is very important as well in terms of self-help materials. We also promote the Beating the Blues, which is a computerised cognitive behavioural therapy programme, which can be accessed with a code from your GP, and we have some information leaflets on that. Mindfulness, this is the sort of the hot flavour of the month, mindfulness. It's been extremely popular and there's a lot of demand, and in fact we could probably spend our whole programme budget on mindfulness given how popular it is. Nutrition workshops through Vital Nutrition with Jane McClinigan, and again those workshops have been very positive, and I can see some participants in the audience who have been to some of those nutrition workshops in the past. Laughter yoga, again they say laughter is the best medicine, and sometimes when you laugh stress and anxiety levels can be reduced, and that is delivered through the positive pathway. We also do your health online in the branches, and it's how to access reliable health information through the internet, so sourcing that reliable, important health information that you may require. And also we participate in health fairs at different events throughout the year, not just within libraries but also externally through our outreach strategy. In terms of some of the partner programs, within the project, Mood Matters would be delivered by Aware Defeat Depression. We also have mental health first aid and mental health awareness training, which would be delivered by Mindwise, as would the Wellness Recovery Action Plan, which is also delivered by Mindwise. Carers Events and Training, which is obviously delivered by Cause, who you'll be well aware of. We would fund some of those programs within the library setting and provide some events that carers can avail of, pampering events to help relieve stress and anxiety levels. Living Life to the Full, which is a 6-week program delivered by Aware. We provide about 4 to 6 of those every year. And also through Mindwise, we would provide volunteering opportunities for people to get involved in supporting their own local community and also helping others to promote mental health and emotional well-being. Action Mental Health would provide our Safe Talk, our Personal Resilience, and also our Provoking Thought programs. In terms of the outcomes, we've been fortunate that we've exceeded our targets and our outcomes that were to be met by the end of October 2014. And certainly when I came in the post last year, most of those outcomes were met due to the great staff team that we have in terms of delivering all those targets. So it made my job quite easy in terms of coming in when things had already been met. To date, over 70,000 people have accessed up-to-date and relevant information to enable them to improve their mental health. The target was 40,000, so we're well and exceeded that target. 6,000 people affected by mental health illness have acquired this self-help skills and knowledge necessary to access and use relevant information to assist their recovery process. The target was 2,000, so obviously we're well and exceeded that target with a total of 6,000. 30,000 people affected by mental illness. Their families and carers have enhanced opportunities for social interaction through reading and learning activities, enabling them to play a fuller role in community life and to access further training and potential employment. So that's that sort of knock-on effect. The target was 3,000, and we anticipate there's been 30,000 people have accessed that so far. There has been an element of double counting in some of the figures. I'll hold my hands up on that one, but I will count it with the lottery. The funder's happy with it. So if the funder's happy with it, then everybody's happy. And we do have all the data and recording databases and mechanisms to show how we've came to those figures. One of the other outcomes was 50,000 people to have a better understanding of mental illness and awareness of the importance of positive mental health, thereby improving their own mental health as well as contributing to tolerance and social exclusion, and the target there was 15,000. And also the target of volunteers, 40 volunteers have improved skills and confidence to participate in local community activity and be a long-term resource for their partner organisations. So that target was met, and Elaine from Mindwise did some terrific work to try and put us up to meet that target towards the end. So the future, as I said before, we'll have a one-year extension until January 2016, which we're pleased about, to continue on with the good work. And we're also keen to continue to work in partnership with mental health and wellbeing organisations to help provide more health and wellbeing initiatives. And next year we'll have some flexibility in terms of being a bit more innovative, not just continuing with the same programmes that we've provided, but also looking at new programmes and new services that we can potentially bring in to the organisation and to the project to freshen things up and create a bit of new innovative programme of work. One of those such things is IMROC. We have developed a good relationship with IMROC in the Northern and Western Trust, so much so that they're booking up our libraries left, right and centre, so it's probably a good thing in a way that they're so keen to come in, and it just shows you the need and the demand for initiatives and programmes around mental health and wellbeing whenever there's such a high booking rate and a high participation rate in a lot of the programmes. So the next year will be a period of transition for the project into Libraries Northern Ireland's core business, and that's creating a legacy of the project. Very often you find that some projects are fixed term and they don't get continued, but hopefully through a transition period and mainstreaming it, it will become a legacy, and it will continue on. It won't just finish, it will be sustained in the long term. And Health and Mind, I believe, can create access to many library facilities and resources province-wide in relation to wellbeing. And for more information today, over lunch or later on in the day, feel free to come and visit our stand here just to the left of the stage. And a lot of our staff, we have a few staff here today who would be more than happy to help access information and support in relation to the project. Thank you.